All right, thank you, Caitlin, and thank you, Azure, for the invitation. Thank you, Sages, and thank you to those of you who are still here for supporting us this afternoon. So again, I'm Rockson Liu. I'm in Oakland, California. I've been in practice for 17 years, and I'm going to talk about the private practice model. I need to keep this slide up for 7 seconds. The important disclosures are, I just started a new medical group, so I'm president of that medical group, Resolute, and it's in collaboration with an administrative healthcare group called Emergence Healthcare Group. So this is how I started. I trained at Virginia Mason and did a MIS fellowship at the Cleveland Clinic. And I can honestly tell you I had 0 lectures and talks on the business of medicine. So when I was looking for a job, I really didn't know much about private practice. I trained at centers with all academic surgeons. And I was very afraid of dipping my toe into private practice. I was seriously worried that I wasn't gonna be able to put food on the table and that I wouldn't really have patients to see and I wouldn't have cases to do. So I went into and joined Kaiser in 2005. For those of you who don't know Kaiser, I wanted to get a job in California, and Kaiser has the most insured patients in all of California. It's an HMO. You're employed when you join the group. And the reasons I joined is because there were lots of patients on day one. I didn't have to network or market myself. No administrative headaches, excellent benefits. Salary was on par with the average, and the pension at the end of your career was kind of a big, like a pot of gold. There was lots of stability. It's a big organization, and they really wanted my MIS skills at the time. And I really enjoyed the surgeons when I interviewed with them. My wife enjoyed the location. It's in a beautiful location in Walnut Creek, California. So I took a job there, and I was very happy for 9 to 10 years. And the reason I'm on stage talking about private practice is because something happened, and I ended up leaving Kaiser. And that something was I got on the robot in 2014. I'm not here to sell robotics, but I'm really, I'm telling this story because once I got on the robot and I realized how much I wanted robotics to be a part of my practice and how much I think it's going to improve patient care, it made me start looking at my practice from a different lens. Well, first of all, they only give me 1.5 days block time per month that I had to share with another surgeon, right? So I was not going to be able to do robotic surgery as much as I wanted to. So, it's funny, once you start looking at things from a different lens or a different perspective, you start noticing flaws and things aren't so perfect anymore. And I started realizing that the boundaries within Kaiser with this employed model was a little too confining for me. There was too much of a factory assembly line mentality. At Kaiser, they pride themselves in having the best doctors, and all doctors are essentially interchangeable, and we become commodities. There's a committee for every request. I want a new chair, I have to go through a committee or send emails to some random person I really don't know. And, in learning robotics, I realized that there's a big chasm between industry and the practicing physician, that there really needs to be physicians kind of in the middle, helping understand the technology, understanding where it fits within clinical practice, and helping surgeons adopt the technology. And I felt like consulting was something that I would really enjoy doing, but Kaiser wouldn't let me do that. So I really considered joining private practice, but the trend over the last few years hasn't been to get into private practice. It's not appealing anymore, right? The AMA over the past few years have been tracking this, and there's been a decline over the last 35 years. In 2012, 65% of physicians were in private practice. In 2020, it finally went below 50%. And there are many reasons, right? Rising administrative burden, increasing regulatory burdens, payments have been flat, and if you adjust it for inflation, it's been actually decreasing. If you're in a small group, if you're alone, you have no negotiating powers with the payers, and IT costs keep going up. Epic just dominates everything, and they charge a lot of money for the independent doctors. But private practice still exists, right? There's alignment of incentives. All my partners work hard because that's how you get paid. I can tell you at Kaiser, the least hardworking physician and the hardest working physicians were paid almost equally the same, right? There's no restrictions in terms of which hospitals you can operate at when you're in private practice. If one hospital is not allowing you to take care of your patients the way you want to, you can move on to the next one. And if things don't go well, you don't have to go through committees or hospital administrators to make change. You just talk to your partners, sit down over some beer or wine, and you just make changes when you're ready. And then if you're in your own practice, you can manage the business according to your personal, financial, and operational risks, right? And again, it's easier to change culture when you're in a small group. But stepping back, I would say a lot of people are in private practice because the clinical part of medicine really is intertwined with the business of medicine, and that's very evident today. And we as physicians are giving up that aspect of medicine, which is the business of medicine, and letting non-clinical folks, folks who don't have our training, our experience, take over medicine and dictating how we practice clinical medicine. So a lot of us want to stay independent, not be employed, so that we can continue to drive what is important in the business aspect of medicine. And having autonomy in hiring, scheduling, doing what interests you is sometimes tough to do when you're employed. So I left Kaiser in 2017, 12 years after joining Kaiser. Just so you know, a lot of people ask me this, I was vested for the pension after 10 years, which made it a little easier to leave Kaiser at 12 years, but I get a small little tiny pension when I retire later. So I joined First Surgical in Oakland, California, and I'm going to go through this history because I'm up here talking about private practice. It should be all peachy and great, and I want all of you guys to leave employment or think about joining private practice if you're still in residency. But it's not all great. So First Surgical was founded in 1960 by Arthur Stanton, and when I joined them, they had 5 physicians, and I became the 6th one. But before I joined, they actually got folded into a multi-specialty group of 50 physicians. And for all the reasons I talked about why private practice is disappearing, they felt the pressure and they felt the need to join a larger group. And this group was built as a group that help surgeons and physicians stay independent. But I can tell you, I never felt more employed than at Epicure. Even though it was a private practice group, a small group, the management was very top-down. The pay structure was very opaque. I had no access to the books. I didn't know how much RVU I had, how much revenue I was generating. I had essentially no ownership in this practice. And so we decided, the 6 of us sat down together and we decided this wasn't going to work out for us. And we left Epicure. Okay, so that's the benefit of being small still. And then we joined a much larger group, also local in the Bay Area, a 500 physician multi-specialty group, also billed as independent practice. And this group is extremely different from the Epicure group in that the accounting is very transparent. I can drill down to the patient and see how much insurance company paid me, when they paid me, if there were any denials. We essentially act as little independent practices within this large medical group so that we get better contracts and our supply rates are much lower. Downside is they have one EMR, which is Epic, and we pay a lot of money for Epic, and we still are responsible for 100% of our overhead. So not totally ideal. So in 2022, I actually decided to start my own medical group because I started working with a healthcare administrator who has this incredible vision. He actually has the backing of the AMA to create turnkey practices for solo practitioners and small group practices. So more to come in the future about that. So if you're on the fence deciding whether you should go into private practice or become employed, or you're employed and you're thinking about leaving your employment and going to private practice, what should you do? Well, number one is you can't go wrong, okay? There was a survey in 2016 showing that employed physicians and private practice physicians are both equally as happy, okay? So you really can't go wrong with your decision. And just remember, you're a surgeon. Your skills will always be necessary. Hospitals make money off of surgeons, okay? So you will never be unemployed and not have work. The decision you make today may be the best decision, but it may not be the right decision in the future, so expect change. And remember, your first job or your current job may not be perfect, but it is the perfect job for you to learn, right? You learn more about medicine, you learn more about employed versus private practice. You learn more about yourself, especially if you haven't been in a real job yet. And you also get to learn about the local environment that you plan to raise your family in, right? There are lots of jobs out there for you to make money, but there aren't a lot of jobs that help you grow and learn, so you want to make sure that you keep that in mind, especially if you're coming right out of training. You want to have a job where you learn not just about being able to work independently without attending backing you, but also learning more about the business of medicine, right? And going into private practice, I think it helps to have an entrepreneurial spirit. This can be fun. Working the business side of things can be actually quite fun. And if you have that entrepreneurial spirit, then it's more for you. Going back to the big picture about medicine, consolidation is really hurting medicine and our profession, right? The cost of healthcare is increasing. A lot of studies are showing that vertical integration increases costs rather than decreasing costs. I don't know if you know this, but Medicare pays more for care provided by hospital-based employees because hospitals can charge a hospital facility fee. Even if you're seeing just a patient in clinic, your consultation, a hospital fee gets tacked onto it just because you're in a hospital-based outpatient center. Big hospital system, they're big business. And businesses, what is their number one motivation? It's revenue, okay? It's not clinical care. It's not that patient sitting in front of you and what their clinical outcomes are. Right? And only 44% of physicians in a study in 2016 believe that hospital employment is a positive trend, okay? And look at the lobbying efforts by the Hospital Association and insurance. Both have paid more for lobbying than the American Medical Association. So there is a lot of effort in the government to keep us employed. So let's say you've chosen private practice. I've convinced you that private practice is the best thing for you. What do you need to focus on? Number one is if you're signing any kind of contract, make sure there's no non-compete clause in there. Okay, there are a lot of non-compete clauses in these contracts, and basically the gist of it is if you decide to leave that practice, they will limit the geographic area which you can work in, so you can't just move over to the next practice within town or next hospital within town. Try to get rid of those non-complete clauses. Learn coding. Coding is the language with which you talk to an insurance company and get billed or get paid, so learn coding. Take a class or talk to a experienced private practice surgeon to learn the ins and outs related to what you do. Understand revenue cycle management, right? How does money come in? What do insurance companies need? You don't have to be a master of this. People take care of this, but you do need to know how the money flows through your practice. Human resources is extremely important, of course, right? You're running a practice, you got staff, you got managers, you got nurses, nurse practitioners, et cetera. First, start with a good office manager. If you have a good office manager, then everything kind of flows from there. Staff, of course, is important. And, of course, you have the ability to set the standards for your staff, right? So don't be afraid to make sure the staff perform the way you want them to. Nobody's watching out for your personal finances when you're a private practice. So if you're not savvy in this aspect, get a good financial planner. Have a good CPA so that, 15 years, 20 years into your practice, you don't all of a sudden realize that you don't have a retirement nest egg to fall back on. And then networking and marketing, of course, is extremely important, and I'll get into that. So in terms of how to get your name out and how to get business, it starts with affability, availability, and ability. And this is in the order of importance. You've probably heard this before, but affability is actually the most important aspect and characteristic that you need to have. If you answer the phone sounding pissed off and the primary care doctor is afraid to call you, they're never going to call you again, right? So you got to be approachable. You got to be easy to talk to. You got to be friendly. You got to make them want to call you when they have a patient that needs surgical care. Availability is the same way. They have patients who want to get into see a surgeon right away, whether they have a cancer diagnosis or they're anxious. You want to be available for them. And ability, oh, am I running late? Okay, sorry. ability. So marketing, just know marketing is, Dr. Tofai is sitting here. She's excellent at marketing. I want to talk to her after this. But marketing is very important in private practice, and it's never been easier than now. I just recently paid for Google Ads. I spent $456 in 6 months and got 310 clicks. If just one of those patients ended up with surgery, I got all my money back. Have a website, because patients like going to websites, and that's where they get information, okay? And then there are a lot of different additional revenue streams when you're in private practice. This is just a list. You can take a picture of this. But, you know, the world is yours, and you feel free to do what you want to do in private practice. So in summary, I love being in private practice despite the issues that I've encountered daily. The autonomy, the control, the flexibility it's hard to quantify. And my wife has noticed that. Okay, so I'm going to finish with this quote. Failure is simply the opportunity to begin again, this time more intelligently. Just remember, you're going to change practices. Don't be so worried about the initial job you take. You're going to learn a lot from it and grow from that. So thank you very much.